Hello, welcome to today's episode. We're diving into a critical topic in women's health, ectopic pregnancy. In this video, we'll explain what a normal pregnancy is, how ectopic pregnancies develop, their causes, symptoms, and treatment options. Let's get started. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus, most commonly in one of the fallopian tubes. In a typical pregnancy, an egg is released from one of the ovaries. It travels through the fallopian tube, where it meets sperm, and fertilization happens. Once fertilized, the egg continues to travel down into the uterus and implants in the lining. In an ectopic pregnancy, something different happens other than the normal implantation in the uterus. The fertilized egg settles in another location, often in the fallopian tube. The fallopian tube is a narrow tube in the woman's reproductive system, which acts as a bridge between the ovaries and uterus. It cannot harbor embryonic growth because of its small size. The abnormal growth of a fetus in the fallopian tube is called tubal pregnancy. Other, less common places where ectopic pregnancy occur includes the ovary, abdominal cavity, or the cervix. Unfortunately, these locations also cannot support the growth of a fetus. Most ectopic pregnancies form in the fallopian tubes because the fertilized egg is unable to move into the uterus. This could be due to blockages, damage to the tube, or scarring. For example, if a woman has experienced inflammation or infection, it can cause damage to the fallopian tubes, making it difficult for the fertilized egg to travel swiftly to the uterus for proper implantation. There are several causes of ectopic pregnancies, many of which involve damage to the reproductive organs. Let's go over some of the most common causes. Pelvic inflammatory disease, PID infections, like sexually transmitted infections, STIs, can damage the fallopian tubes and lead to an ectopic pregnancy. Previous tubal surgery. If a woman has had surgery on her fallopian tubes, there may be scar tissue that blocks the egg from reaching the uterus. Hormonal factors or genetic abnormalities. In some cases, hormonal issues or genetic abnormalities in the reproductive organs can prevent normal implantation. It's important to note, of the three causes of ectopic pregnancy discussed, pelvis inflammatory disease PID is the most common cause. The causes of PID are bacteria, commonly chlamydia and gonorrhea. This bacteria can cause severe scare, accumulation of thick mucus and inflammation of the fallopian tubes, hindering the free passing of fertilized eggs to the uterus. There are also several risk factors that increase the chance of an ectopic pregnancy. Here are the top ones to be aware of. 1. Previous ectopic pregnancy. If you've had an ectopic pregnancy before, your risk is higher for another one. 2. Age. Women aged 35 and older are at higher risk. 3. Smoking. Studies show that smoking can increase the risk of ectopic pregnancy. 4. Infertility treatments. Certain treatments, like in vitro fertilization, IVF, have a slight risk of ectopic pregnancy. So, how do you know if you have an ectopic pregnancy? The early symptoms can sometimes mimic those of a normal pregnancy, but there are some warning signs. Sharp abdominal or pelvic pain. This can be on one side and may come and go. Vaginal bleeding. This may not look like a regular period. Dizziness or fainting. This is a sign of internal bleeding and requires immediate medical attention. Shoulder pain. This can happen due to internal bleeding irritating the diaphragm. Note: most of these symptoms are also applicable to some other health conditions. It's important to consult your doctor for proper diagnosis. If diagnosed early, there are two main treatments for ectopic pregnancy. Methotrexate. This is a medication that stops the pregnancy from growing. It's used if the ectopic pregnancy is caught early and the tube hasn't ruptured. This medication is administered under a doctor's supervision. Surgical treatment. In more severe cases, surgery is required to remove the ectopic pregnancy. Sometimes, this can be done with a laparoscopic procedure, which is minimally invasive. While not all ectopic pregnancies can be prevented, there are ways to reduce the risk. Avoid smoking, practice safe sex to prevent infections, and have regular checkups with your doctor if you have any concerns about your reproductive health. If you suspect you're experiencing an ectopic pregnancy, it's crucial to seek medical attention immediately. Early detection can save lives.